Okay, hello, my name is Courtney Ball. I'm currently a doctoral candidate at Pacific University in clinical psychology. So I've been completing my clinical practicum work at Children's Program this year under Dr. Nicole Sage's supervision. So this presentation was reviewed and approved by Dr. Sage. I'm so excited to present on this topic. It's a topic near and dear to my heart because I've worked in pediatricians' offices and hospitals and really have experienced firsthand the fear and screams and worries of children who dread receiving shots and blood draws. It's also a really timely topic as 12-year-olds and older have recently become eligible for the COVID-19 vaccination. And I'm sure as time continues, we'll continue to see more eligibility for a wider age of children. So the goal of this presentation is to give you some background knowledge into needle fears and phobia, and to ultimately equip you with ideas for how to support children and adolescents, teenagers to help improve their experiences with doctors and routine medical care. All right, with that, I want to provide a disclaimer. This is a free community presentation for information and educational purposes. So attending this presentation does not initiate any type of patient-provider relationship at Children's Program. I'm not going to answer specific diagnostic questions about any particular family or children during the context of this presentation. If at the end of this presentation you learn some information that makes you interested in initiating services with a mental health provider, please contact your child's insurance and find a provider within your network. Okay, just important to make that disclaimer before we get started. I want to start with fear. So fear is a natural response. Fear helps protect us and makes us alert to danger, and it prepares us for danger. Feeling afraid is helpful in certain situations. So for example, fear can be like a warning or signal that cautions us to be careful. When we sense or experience danger or we start to feel unsafe, we can become fearful. So fear is programmed into the nervous system and works really similarly to an instinct. From the time we're infants, we're equipped with survival instincts necessary to respond with fear when we sense danger or feel unsafe. So this is facilitated by a structure in our brain called the amygdala. And if you're familiar with that structure in our brain called the amygdala, it's involved in our fear responses. So emotions like fear or anger can trigger reactions from the amygdala. When we're operating from the amygdala, we react really quickly. And this is when typical brain and bodily responses like freeze, flight, and fight are triggered. These really serve as our body's defensive action against threatening situations. So just as fear is a natural expected response, certain fears are really normal during childhood. When we think about childhood and fear, childhood is characteristic of frequently experiencing new and unfamiliar situations, objects, people. And fear can be a natural reaction to feeling unsure and vulnerable in a lot of these new situations that children are encountering pretty frequently. So certain fears are really going to be normal during childhood. So how can we understand normal childhood fears within the context of their ages? So if fears are natural and expected, what are considered normal fears? It can be helpful to break down normal childhood fears into general age categories. So young children, and we're thinking about ages 4 through 6, engage in more imaginative play and pretend play. And their thinking is really within that too, that imaginative and pretend play type thinking. So it's often the case that they're fearful of things like scary monsters and dark rooms and scary dreams, or maybe loud noises. On the other hand, as children get older, they begin to fear things that could happen in real life. So older children, like we're thinking about ages 7 and older, can be fearful of bad guys or villains, natural disasters, or getting hurt, as they're starting to learn and understand more about the world around them. So school-age kids may also feel anxious about schoolwork, grades, fitting in with friends. Preteens and teens may have social fears like being well-liked by peers. And as kids grow and learn with the support of adults, many are able to slowly conquer their fears and eventually might outgrow them, or they don't really get in the way of their functioning or, start to impede into their life. However, like all emotions, fear can be mild, it can be medium, and it can rise to that level of being intense. So, depending on the situation and the person, a feeling of fear can be brief or can last longer than we're really surprised. It might be a little bit longer than expected. So, some kids are more sensitive to specific fears. Fears can be too intense or last too long, and some kids may have a tough time overcoming their fears. So when fears last beyond an expected age or kind of rises to that level of really high intensity, it might be a sign that that child is overly fearful, worried, or anxious. Children whose fears are too intense or last too long might need that additional help and support to overcome them. So when does a fear become a phobia? In terms of a definition for phobia, according to Nemours Kids Health Behavioral Health experts, a phobia is an intense fear reaction to a particular thing or situation. With a phobia, the fear is out of proportion to the potential danger. The danger feels real because the fear is very strong with phobias. Phobias cause children to worry about, dread, feel upset by, and avoid the things or situations they fear because the physical sensations of fear can be so intense. And a phobia causes the brain's alert system to have a false alarm, really generating intense fear that's out of proportion to the situation. So because this fear signal is so intense, the child or teenager becomes convinced the danger is greater than it actually is. So let's think about, again, distinguishing between these normal fears and phobias. In the counseling and psychology world, we use a manual called the DSM, and this is the Diagnostic and Statistical Manual of Mental Disorders. We use the most current 5th edition version of this manual. The DSM contains criteria that need to be met for each diagnosis, and when we're determining whether something is a normal fear or has risen to that level of phobia, we use these criteria to help inform us. So on this slide, I've included some criteria we often consider. So is the fear unreasonable and excessive? Is the fear persistent? Is it intense? Is there an immediate anxiety response? So the fear must be out of proportion to the actual danger and appear almost instantaneously when presented with the object or situation. Children can experience a variety of physical symptoms when anxious or worried, including increased heart rate, sweating, trembling or shaking, shortness of breath, upset stomach, feeling dizzy or faint, things of that nature, those physical sensations, those physical symptoms. Is there avoidance or extreme distress? So is the child trying to avoid the object or situation, or will they endure it only with that extreme distress? And finally, is it life-limiting or getting in the way of functioning in a specific way or setting? So is the phobia impacting the child's life and keeping that child from doing the things that they would like to do, they would enjoy to do? Okay. And when we think about getting in the way of functioning, especially for kids and teens, we oftentimes are thinking about that school. Oftentimes, like, is it keeping them from being in school? Is it keeping them from getting the routine medical care that they need? Is it keeping them from doing something in their lives? So really keeping in mind what that getting in the way of functioning might look like for the child. So there's different types of phobias. So there's 5 types of specific phobias. So the DSM includes diagnostic subtypes of phobia. And on this slide, again, there's those 5 types of specific phobias that are included. So they include natural or environmental. So for example, fear of thunder and lightning or fear of water. There's injury, which can be fear of shots or injections. We're thinking about that needle fear and phobia here. There's fear of animals, so like dogs, snakes, or insects. There's situational, like enclosed spaces, which we oftentimes refer to as claustrophobia. And there's this other category that might deal with choking, vomiting, loud sounds. kind of a catch-all place for some additional phobias that come up for kids and teens and adults. So we're going to focus specifically on needle phobia. And to introduce this topic, I want to start by showing a quick film, if we can get it to work. Let's go ahead and stop sharing here for a second. We can't get that one to work, but I'll give you a good sense of what this one talked about. So within that video, we hear about terms, needle phobia is being described using terms mentioned like balenophobia, which is fear of needles and pins, trypanophobia, which is fear of injection, and acmeophobia, which is fear of sharp pointed objects. So in that video, we just have some cute little kids just talking about what it's like to be kind of scared of needles, what it's like to understand some of these terms like balenophobia, trypanophobia, and acmeophobia. So in terms of prevalence, there are a variety of estimated prevalence rates for needle phobia, with most hovering around 3.5% to 10% of the general population. However, in specific populations of children, needle phobia prevalence might be a bit higher. So if we think about the prevalence of needle phobia within kids and teens that are managing diabetes, it tends to be a little bit higher because they're having to deal with those needles a little bit more frequently. So we're seeing it at a little bit higher of a rate than that 3.5% to 10% of the general population. The age of onset is typically around early childhood, so about 5 years of age, which makes sense if we think about vaccine schedules. So by age 5, kids will have typically received quite a few needle pokes. Okay, I really appreciate, where we go? Okay, so I really appreciate thinking about some different perspectives when we're approaching and trying to understand these needle fears and phobias. So on this slide, we have this developmental perspective. So here I'll read it out to everyone. So preschoolers are at a vulnerable period for developing phobias. 4-year-olds are developmentally more prone to fear, are very sensitive to their parents' anxiety, and are concrete thinkers for whom good and bad are binary. Doctor good, pain bad. They remember traumatic events and tell themselves stories to make sense of the world. If a good place where they're supposed to be safe turns painful, they have to be held down and their parent is upset. To make sense from their perspective, it is a traumatic childhood event. To avoid causing a phobia, reduce that trauma. So this developmental perspective is really helpful to kind of read through and talk through. Dr. Amy Baxter is a pediatrician. So I appreciate this quote because it gives us that perspective on how these fears develop and how it can lead to long-term fears of shots and even routine medical care because of that story and that narrative that a young child develops, especially when they're young. And again, it talks about that binary of doctor good but shots bad, or being really fearful or having stuff that's really outside of the child's control happening that's really scary. We also have some evolutionary and biological perspectives that help to make sense of these fears and phobias. So there's evolutionary benefit to avoiding stab and puncture wounds. Avoiding these wounds lead to a greater chance of survival. And there are also evolutionary benefits for the body to respond a certain way following a stab or puncture wound. So for example, since someone's exposed to a dangerous or feared object, their arterial pressure and heart rate increases as the body gets ready for that action. And immediately afterwards, arterial pressure decreases, which is really advantageous because it leads to blood clotting and a decrease in blood loss. So unfortunately, this process also in some cases leads to that dreaded fainting, falling of blood, or blood draw. So you can see here, these are supposed to be little arrows, but they turned into little boxes. So decreasing arterial pressure after sustaining an injury, leads to blood clotting, leads to that decrease in blood loss, and then unfortunately sometimes fainting. So again, this is really evolutionarily beneficial, because if you had this happen to you in the wild when we were cavemen or people long before modern times, we would be able to clot faster and decrease that blood loss. So on this other side of the slide, we can see biology also plays a part. So about 80% of adults with needle phobia reported that a first-degree relative exhibited similar or that same fear. Also, patients with needle phobia tend to have biological relatives with needle phobia at a much higher rate than other types of phobia, which is a really interesting statistic there. So these perspectives have really helped us understand that needle phobia results from a combination of things. So those things can include biology, so that potential that you have someone related to you that has that fear. It also can come from evolution, making those puncture and stab wounds more survivable when we had this increase in blood clotting and decrease in blood loss. And it can stem from these life events. So we think about what it was like when our child first got a shot. Was it really hard for them? Was there lots of screaming? Were people holding them down? So all of these things can go into kind of forming this fear and this phobia. So there's 4 types of needle phobias. Okay, there's vasovagal, which refers to when the sight of a needle triggers a sudden increase in heart rate and blood pressure, followed by an immediate slowing of heart rate and decrease in blood pressure. So this reduction in blood flow to the brain occasionally results in that fainting response. So people fainting during needle procedures report more of a fear of fainting, that fainting reaction, rather than fear of the needle procedure itself. There's also associative, which refers to a traumatic experience, like we were talking about in the developmental perspective. So an extremely painful medical procedure could lead to a child associating all the procedures involving the needles with the original experience. This can also refer to when sensations and side effects of some of the injections are associative with the fear of needles. So potentially, if a child has had to undergo a course of some difficult hospital procedures with some needles and they had side effects immediately afterwards, those things can be associative and then create that fear of needles. There's also resistive, so that refers to a dread of needles and injections and a fear of being controlled that stems from that physical and emotional restraint that's been associated with prior needle procedures. So a lot of times, we're like, we got to get this shot done. We're going to hold you down, and kid feels out of control and freaks out and then becomes more resistive. Then there's the hyperalgesic, so that refers to the fear of excessive injection-related pain sensation. So that's more of that fear of that pain that comes with the needle poke. So now that you have some background and some perspective that helps us understand how needle phobia emerges from that combination of genetics or biology, evolution and life events, I also want to introduce the cyclical nature of needle fear and phobias. So that is what the child thinks. So I'll hover here. So what the child thinks impacts how the child feels, which impacts how the child's body responds, which then impacts how the child behaves. So this is all a cycle. All of the things are sort of an interplay. Okay, and I can show you how that works on the next slide. So we start here. The child thinks the shot is going to hurt me, which leads to the child feeling afraid, really those emotional experiences of being anxious, stressed, and scared, which leads them to feel this physical sensation of panic and stress, which could include sweating, trembling, maybe an upset stomach, headache, dizziness, fainting. Then we move to, unfortunately, the shot refusal. So refusal to attend doctors, maybe dentists, avoiding medical procedures and visits, because this cycle just keeps continually going. And this type of refusal really has long-term consequences on how this particular child or teen is going to get routine medical care in the future. So we have to think carefully about how parents and providers can change their reactions so they don't heighten child's fear or teen's fear, which can really accommodate and worsen the anxiety, leading to the cycle happening over and over and over again. Okay, so we're going to get into some ideas for how to break up this cycle and ways parents can just can help in just a little bit. So here's another really lovely quote from Amy Baxter, who's that pediatrician I noted earlier. So needle fear impacts patients' health choices for life, their likelihood to immunize their own children, and it's iatrogenic. We need to take it seriously. Okay, so I talked about that kind of wide-ranging consequences, getting stuck in that needle fear and phobia cycle, and one of the consequences is really well captured by this quote. That fear is going to trickle down. It's going to impact their own health. It might impact their children's health. It might impact their choice to immunize their children. And I also want to point out this word iatrogenic. So that's iatrogenic is of a disease or symptoms that are induced in a patient by treatments or comments of a physician. So she's kind of talking about here that this is something that's coming about due to how we're handling these situations in the doctor's offices, how our doctors are handling, how our medical staff are handling it, and how we can kind of change that and improve that so we're not having this occur due to the treatments and comments of their doctor. So, there we go. So it's really important to think about as a child ages and moves into adulthood, they'll continue to experience that fear, reluctance, and avoidance. So that cycle will continue, and it's going to generalize to more things. It'll be shots, it'll be vaccinations, it'll be potentially medical procedures. If we think about, there are some different types of illnesses or different types of treatments that require needles or blood work. And so that fear and that avoidance is going to build up to potentially not receiving that medical care like they need. So this is really on the individual level, that avoidance of doctors' offices and hospitals, the generalized fear of medical and dental healthcare providers, that refusal to receive routine checkups and vaccines and really important medical care. This is what can really happen on the individual level, and we've kind of focused on that, and maybe even like the next generation, not immunizing your child. But on this broader level, shot or injection fear, needle fear or phobia, it's potentially going to contribute to a decrease in vaccine compliance. So it's also going to kind of lead to this increase in preventable illness and death, and decrease in protection in schools, communities, and across the nation from different diseases. So it's really important. It's not just within our own children. It's not just within their children. It's on this really broad level as well. So it impacts so many different individuals. In terms of how do we manage this? How do we understand what to do at this point? If we've identified that our child is maybe experiencing this fear and it's getting in the way of routine medical care, it's frustrating, we don't know how to move forward, there's some different ideas for intervention and for management. The first one is cognitive behavioral therapy. So this is a type of therapy modality that kind of looks at that. I'll go back to this little piece for us. Cognitive behavioral therapy really focuses on what a child thinks, how they feel, how their body responds, and how they behave, how these cycles work, and how we can disrupt these cycles. Especially in this case, we'd want to, kind of get in there and understand some of how these thoughts are impacting their behaviors and how their thoughts and feelings are impacting one another. So that really gets taken apart of and understood within that framework of cognitive behavioral therapy. There's also exposure therapy. So that can mean slowly exposing a child or a teenager to something they're fearful of. So that's something that's a very helpful thing to do with children. And that's done within the context of a therapeutic relationship with a mental health professional. There's also systematic desensitization, gradual exposures, and fear hierarchies. So we're going to go into a little bit more depth about that in the next slide. But systematic desensitization refers to, again, using this sort of exposure to something we're fearful of and getting our system desensitized to it. So over time, when we're gradually exposing to some of these things, we're going to learn that it's not that scary, and we're teaching our body and our brain that this isn't something scary that we need to be fearful of or anxiety producing. So we're desensitizing our system. And we're doing that through that gradual exposure. And we use those fear hierarchies to work through that gradual exposure. There's also relaxation techniques, and that can include a variety of things. I have a little asterisk here because it's important to realize that some relaxation, well, generally, relaxation methods are contraindicated. So they're not helpful in cases of vasovagal response, so that fainting response, due to the risk of decrease in heart rate and blood pressure. So instead, graded exposures, so those graded exposure approaches where you're going to relying on applying tension as a way to prevent complications is going to be really important for that vasovagal response. So that graded exposure, and then also applied tension. That's what we're going to use when we identify that fainting piece. When your child's just fainting a lot, that fear of that fainting, that's getting brought on by those needles. However, if that's not the case for your child, if your child's dealing with this fear of this needle and really scared of this happening, relaxation techniques are helpful, like progressive muscle relaxation. So tensing and relaxing your muscles and deep breathing, those are really, really helpful. So there's that next point is that applied tension and pressure, which we can use with the vasovagal response. And there's also muscle tension. We can use distraction, and that could be blowing bubbles, watching YouTube videos. So distraction is getting them in that room quickly and then pairing that immediately with having some sort of reward or a treat, changing that situation and getting them out of it. So getting them in the room, making sure they know what's going to happen and what to be expected, having that shot happen, then they immediately get a reward, and changing them and getting them out of the situation. So do quick distraction training in the waiting room, help with their anxiety and help with kind of easing them during those injections. Parents can also lead some distraction with the help of the MA or other medical staff. So this is a really important piece of kind of letting your medical team know that this is something your child struggles with, and seeing how they can kind of get involved in leading that distraction or talking through your child with that distraction, and you helping as well. Another really important piece is parental reactions. So sometimes when we're really stressed or really anxious about what's going to happen, or we've seen that our child has this really, really poor reaction, and so we're like, oh gosh, I'm really worried that they're going to freak out again. So that really rises your stress and anxiety. We have to think about how we can kind of switch our reactions, our parental reactions, and manage our own anxiety so that we don't negatively impact our child. There's also a surprising amount of medical interventions and offerings that often parents don't really know much about, and many people don't know exist. So, for example, there's the Buzzy Bee, which is a distraction technique and tool that can be used in the office. So it's kind of based on this pain gate control theory. And that's just a fancy theory for basically saying, if your body is experiencing signals, non-painful signals, or just other signals of sensation somewhere else in your body, it's not going to focus so highly on that pain that they're experiencing. So this Buzzy Bee kind of like buzzes and gives some distraction from the buzz so that the pain isn't really getting received into the brain. There's also shot blockers, which operates really the same way as the Buzzy. So it has little spikes and you hold them down and the brain focuses on those sensations instead of that pain from the needle. Also for infants, in case there's anyone who has babies that really struggle with this, there's something called stupor solution, which is a sweet solution that's put on the baby's tongue and the child sucks on that, and again, that distracts from that painful sensation. It can also be really important to think about being really well hydrated for the day of the appointment, trying to increase that hydration to avoid feeling dizzy or sick or from passing out. Okay. Whoops. So I know we talked a little bit about fear hierarchies on the last slide. I kind of introduced fear hierarchies, but fear hierarchies are really helpful tools, especially when we're dealing with these fears and phobias, because overcoming a fear, a really intense fear or phobia, starts with making a long list of the child's fears and creating a fear hierarchy. And this is something that we do with a therapist. This is something that a therapist has really good skills, especially a cognitive behavioral therapist. They're going to have that skill to help your child or teenager come up with that long list of their fears and create that fear hierarchy. So a fear hierarchy is a ranked list of your child's fears and concerns, with the least feared at the bottom and the most feared at the top. And it's going to be that gradual exposure and going up that ladder of that fear hierarchy till they get to the very top. So again, gradually, and with the support from a mental health therapist and from family and from parents, your child or teen is going to try each fear situation on the list one at a time, starting with the least feared. So along the way, a therapist will teach relaxation skills like deep breathing, muscle relaxation, or like soothing self-talk, or sort of affirmations in their mind to help them relax when they go through these different rungs of the ladder. So as the child gets used to those feared objects or the situation, that brain adjusts how it responds. Again, it goes back to that idea of systematic desensitization. So the child is absolutely not forced to do anything or go beyond a place of, if they're feeling uncomfortable, if it's going too fast, the pace slows down on that fear hierarchy. It's never going to be like I'm going to push you all in, I'm going to push you into the deep end of the pool and see how you swim. It's going to be, we're going to slowly start to walk into that pool, start to feel safe within that pool, and then move to higher, scarier places. So getting closer to the deep end, using that same analogy. So the brain adjusts how it responds, again, through that piece of systematic desensitization, or essentially teaching your brain to slowly build up the tolerance for the feared object. And the brain, over time, learns that you don't have to trigger that alarm system when faced with the object. That amygdala starts to stop firing so much in response to that object or that fear. Okay, so here's an example of a fear hierarchy or a fear ladder. Again, gradually expose. In this example, if we're going to use this fear hierarchy for our needle fear phobia, we're going to gradually expose the child to needles in a controlled, safe setting. So we might start really low at the bottom here, or we might start with seeing pictures of a needle, seeing a video. Then we might move up to sitting in the waiting room, thinking about getting the shot. We might also just go to the doctor's office without actually getting the shot, just like preparing, this is the place where it's going to happen. This is a doctor's office. I'm going to talk to those doctors. I'm going to see them. This is safe. Okay. Then we might, move up a little bit more, use a stuffed animal or something else like an action figure stuffed animal, some toy that they really like, and show them getting a shot and being happy, okay, and getting a treat or reward afterwards, getting a sticker, getting some ice cream, something like that. Then we might move up even more to seeing a syringe without a needle, then a syringe with a needle. And again, once we move to these things with needles, we want to be really careful and really safe, especially with younger ones. So this can be done with the medical staff, with someone who can be safe with these things. We're not just going to go buy a syringe and a needle and have your child kind of play with it. We're going to do it in a safe, controlled environment, especially with some of these medicalized things in a medical setting. So eventually we're going to get up to allowing the child to safely hold a syringe maybe and the needle, again, depending on their developmental age, and being really safe with these things until we kind of get to the top of receiving that shot. So the hardest part is really starting here. It's getting started. It's starting with the beginning of that desensitization, of climbing that fear hierarchy, of doing these things. And once we start to get going, it gets a little bit easier, although it is scary. I think there's kids that move through it and they get nervous and they get scared. And if that happens at any point, we don't want to force a child to do something that's going to scare them even more and build up more of that anticipatory anxiety and fear. So we can slow down, take a step back. And again, we're going to be doing this with a mental health therapist who knows how to move through these things. So it's going to be helping to support you, your family, and your child to move through these hierarchies. So supporting young children, how can we support our young children? So for younger children, or really any age, modeling is very important. So when we say modeling, it means showing this thing happening either with you or with the stuffed animal, showing them what it's going to look like, what the expectations are, and that things are going to be safe. So we can buy toys. So that can include like toy needle kits, like doctor's kits. We can provide access to stories and books about visiting the doctor or getting shots. So there's some cute books that you can kind of get and show that it's safe to do this with fun cartoons. We can practice and play at home and let the child give the caregiver a shot with maybe one of those toy shots. We can create visuals and pictures of the sequence of how shots are given. So first, the doctor comes in the office and talks to you. Then the nurse will come and give you a shot. Again, making it more advanced for older children. But when they're young, just kind of giving them some pictures and some ideas of what this might look like. You can also create a schedule or plan for the day of the shot. And in the shot plan, really adding in opportunities for the child to feel in control or make choices so that they feel like they're a part of their medical care. And honestly, as time moves on, we want them to become more and more involved in their medical care. So this is a good place to start. So for example, holding your caregiver's hand. So holding mom or dad's hand, giving mom or dad X amount of hugs before the shot starts, sitting in the caregiver's lap, picking a favorite YouTube show to stay distracted. So giving those choices, giving those options, picking between ice cream or a special inexpensive toy when the shot's over, having mom or dad telling me I'm brave. These are all different ways that you can give choices or options of having them to feel safer and in control. You can also create a shot backpack. So that can be a backpack that includes comfort items, not just distraction items. It can also be something that's like sensory items like fidget toys or soft blankets, or something that makes them feel safe or loved, or something that smells nice. So it's important to recognize the behavior we're targeting with our praise and with the rewards is this distress tolerance. So which means staying calm, not moving around. We really want to reward those calm bodies. We don't want to try to sort of reward and praise not crying. So sometimes when we're being brave, especially young children, when they're being brave and when they're being calm, they might still cry. So we really don't want to, we want to encourage that calmness and that braveness, calm bodies, great job being so brave. So how can parents support older children? So there's a lot of overlap here. There are some things you can kind of modify to help with older children, but we want to prepare by scheduling preview appointments. Like I was saying with that fear hierarchy, something that we can do is we're going to go into the doctor's office and we're not going to get the shot on that day. We're just going to preview. We're going to see what needle it is, or we're going to see what is going to happen. We're going to talk to the doctor and the nurses. They're going to help us feel safe. We can also create a toolbox or menu of ways to calm our bodies and cope with shots, like using a tools and toolbox. So I can use my deep breathing, or I can relax my body, or I can listen to a YouTube video that I like. So really coming up with some specific ways that they will feel more calm or feel like they can cope with those shots. We can also create a schedule or plan for the day of the shot, and that can be a little bit more I would say like a little bit more specific than a child one would. So we could use more pictures, we could use more structure, more words and things, and that one than we might use for littler ones. We can use distraction like YouTube, or using their phone in those moments, or listening to some calming music. Parental tone of voice and language and reassurance is also really, really important. So research indicates that excessive parental reassurance or criticism or apology will increase distress, while humor and distraction tend to decrease distress. So it can be helpful for parents to use a confident tone of voice, reassure the child or teen they can handle it, and tell them things like, "You're brave and you can do hard things. I believe you can do this." It's really incredible how much a parent's confidence can impact compliance. So some other example statements we can make are, you're going to get a shot, you're allowed to be worried, and I know you're going to be brave. So really validating that it's okay to be worried. We're still going to get this shot, and I know you're going to be brave. We're going to follow through with it. And allow your child to make some decisions to be in control. So like older kids could tell the MA or nurse which arm to start with or which arm they would prefer the injection in, but really be careful with giving too many choices to these older kids. So avoid teaching your child that they can cry to get out of the shot or that you're going to indefinitely reschedule the shot. The choices should more be like, in the office, where would you like to sit? Which arm would you like to have? What YouTube video would you like to listen to? Having those choices within, we're going to follow through with this thing. You're not going to be able to get out of this thing because that's going to increase the anxiety. Okay. And finally, rewarding and praising. Those are they seem simplistic, but they're really big. Telling your child, I'm so proud that you did that. You did such a great job keeping your body calm. I'm so happy for you being able to get through this. That was really brave of you. And then immediately rewarding. And you can kind of think about and brainstorm some of those things ahead of time. So you did a great job getting this shot. Now you get to have this special treat. Now you get to have this special toy. And it doesn't have to be something really crazy or expensive. It can be small, but really pairing that thing with the reward. So some common questions that come up when it comes to how do we manage the situation with our child. So often we receive a lot of competing information regarding how to facilitate shot appointments. So I want to talk through some of these questions and really help work through them for people watching this today, because I think that this is something that's come up with a ton of different caregivers and parents. So I'd also like to preface that with every child, it could be, it's really, really hard to manage these things. We try our best. We want to have our children feel safe. We also want them to get the medical care that they need. So when I'm covering these questions, there's no judgment or criticism if you've done something that's not exactly perfect. It's really, really hard to always make the best choices when we're trying to do the best for our children. So the first one that comes up a lot, holding children down for shots. Should we do that? So this typically happens with young children. We might just hold them down to get that shot taken care of. So instead of holding them down, we can kind of instead have your child sit in your lap as opposed to holding them down. Again, that holding them down could lead to that feeling of being out of control, that fear, and associating of, I go into the doctor's office, they hold and physically restrain me down to be able to do this thing that's really painful and scary. So we're pairing those two things, and it's potentially leading to that increase in that fear and maybe ultimately a phobia of getting that needle or that injection. Okay, so again, sitting in a parent's lap is a better alternative. What about surprising a child with a doctor's visit or with shots? So ideally, we want to talk to children beforehand. When we walk into the office and we're surprised with something really scary, it's going to be a lot harder than in the future to kind of help with that anxiety, because as a child, they're learning, I get surprised with really scary things in this office. So we want to start having these conversations beforehand. So another one is white lies about how shots feel. So like, you won't even feel it, you'll be fine. So honesty is going to be helpful. It's going to help your child trust that you and your medical provider in these moments are going to tell them the truth. So you can say, yes, it'll hurt, but it'll only last for a little, and really really help focus on the plan beforehand. So use that distraction, and then afterwards that fun activity or reward. So again, being honest that this is gonna hurt a little bit, or it might hurt a lot, but it's only gonna hurt for a little bit. And using that distraction on the front end and that reward on the back end to kind of bookend that this is gonna be not so fun right now, but we're gonna have distraction beforehand and we're gonna feel better afterwards. How about multiple shots or injections in one visit? So studies have shown that multiple injections at once may cause more fear. So fewer injections, if possible, are going to be helpful in lessening that child's trauma or fears around this. So the longer that children have to solidify a traumatic experience, the better they remember it. So if they're really experiencing these situations that feel very traumatic for them, we want to decrease the injections if possible. So do we give the shot even if a child is upset or dysregulated? So a child who's really dysregulated, we can try to get them into a relaxed state, but we really don't recommend giving a shot to a dysregulated child. Again, they're really out of control of their body, they're screaming, they're fearful. Ideally, we want to wait until they're calm, or to try maybe doing it the next time after you've given them some idea of what's going to happen, some expectations, we prepared them on the front end. How about talking the child through it? So humor and distraction, plus using a really confident tone of voice and short, concise reassurance that the child can handle it is going to be really helpful. So saying statements like, "You're brave, you're doing such a great job doing this hard thing." I think it's absolutely helpful to talk a child through that and use that humor and distraction and show them that you're there and supporting them. So how far in advance do I tell my child, and how far in advance do I prepare them for the shot appointment? So at least a day. Ideally, it would be better up to a week beforehand. So this measurement is really helpful in telling kids most things. So if we tell them a month in advance, they're going to worry for that entire month. If we tell them the day of, they're going to freak out or like say, I don't want to do this, or it's going to rise that anxiety. So we want to make sure that we're giving them some time to process this, but not giving them so much time that they're going to be ruminating about it and thinking about it constantly, okay? So ideally a week. If it has to be a few days beforehand, again, it depends on the child, but we don't want to surprise our child about these things. Okay, so this is the end of the presentation. I hope you enjoyed learning some of these things about needle fear and phobia. And again, if you're feeling like this is getting to be so intense that it's hard to manage, reaching out to a therapist. And we can do this through contacting our insurance carriers. A lot of times they'll have recommendations for therapists that are within our network, so we don't have to pay out of pocket. That can be really an ideal way of finding that additional support. And just knowing that some of the things that I recommended, you can start to use and start to see if they're helpful within these shot appointments. So I hope you have a great rest of your day.